Hi everyone, my name is Janine and this is Ralph. And I'm an anatomy instructor here at NSCC. We're just going to take a little bit of time kind of looking up close at Ralph to sort of understand the structure of the skeletal system. So tag along. So we're first going to start with Ralph here talking about different types of bones. So there's four main types of bones. We have long bones, we have short bones, we have flat bones, and we have irregular bones. So if we take a look at the long bones first, it's pretty easy to pick out some long bones because they're known for their long shape. We often see long bones in the appendicular skeleton, so the arms and the legs. Humerus here, this is a long bone, as well as the femur, the radial bone and the ulnar bone, as well as the tibia bone and the fibula bone. I'll move Ralph back here so you can see here. The tibia is the larger bone here. And then the fibula is sort of the smaller bone here. We also have long bones in our hands and our feet, in our metatarsals and our phalanges. These are our long bones here. And the point of long bones is to really contribute to weight-bearing bones. Think about these are the parts of our body that take a lot of weight. So these long bones help to take that weight, and also help contribute to height and to other length in our bodies. So next we have short bones. If I move Ralph up here, you'll see the wrist is a really great example of short bones. Often with short bones, you can see that they're clustered together, and there's often several of them together. So short bones we often see in the wrist, and then in sort of the bend of the foot here. This small bones coming together really helps with ease of movement in this area. If we look at our hands or our phalanges or metatarsals, these are still considered long bones, even though they may look short, but the proportions of them are a long bone, not a short bone. Short bones, again, if we move it a little closer, you can see they are significantly smaller, where these long bones, although they're not as long as a humerus, but they still have the same properties to them. Next, we're going to talk about flat bones. So what do flat bones do? They really protect organs. So if we think about flat bones, we think about the skull and the cranium. That's made up of flat bones. This thoracic area here, these are all flat bones as well. Flat bones help protect the body organs. And you can see just by looking at them, they sort of have a flatter appearance. Examples of flat bones are the occipital bone, the parietal bone, the nasal bone, lacrimal bone, vomer bone, hip bone, sternum, ribs, and scapula. So the hip bone here, also considered a flat bone, and then the scapula, which is our shoulder blade here, also a flat bone. Always protecting. We're protecting the pelvis, bladder, lower abdomen, rectum here with the pelvic bones. Scapulas are protecting the lungs and the back. This thoracic area, the rib cage, is protecting the heart and the lungs. And then of course the cranium is protecting the brain. And then finally we have irregular bones. Irregular bones have some type of degree of movement for them and some type of flexibility with them. Often with irregular bones, they help accommodate other structures. Examples of irregular bones are the vertebrae here on the back, which helps protect the spine, the sacrum, which is the lower area here, and then the coccyx, the small bone that we're going to talk about a little bit later, and then a lot of the facial bones, like the sphenoid bones, zygomatic bone, maxilla bone, mandible bone, palatine bone, and the nasal concha. We'll talk about them in greater detail coming up. Before we get any further here, I do just want to talk about the hyoid bone. The hyoid bone is missing from Ralph. The hyoid bone, floats kind of right under here, underneath the mandible. And it is known as the only bone that does not attach to other bones. It's anchored by muscles from the anterior, posterior, and inferior direction, so from all around, and aids in tug movement and in swallowing. We do not have a hyoid bone here on Ralph because since it is not attached to any other bones, there's no way for it to be there. Next we're going to talk about the cranial bones, or the bones of the skull. We're not going to be really able to go that in depth with facial bones using Ralph because this skeleton is not specific enough for that. But we'll take a look at the cranial bones next. So if we're talking about the cranial bones and we use the acronym, 8 osseous parts form the skull. We'll start with the ethmoid bone first. So the ethmoid bone is a little bit hard to see, but it forms the floor of the cranium, and the middle makes up its nasal septum. So the ethmoid bone is sort of found right in here. Okay, now we have Ralph turned around, and we can sort of look at the back of the skull and the cranial bones. If we see here, this here is what at one point was our fontanelles or our soft spots as babies, but then it has grown to our synaptharsis joints, which are fused together and immovable joints. So here you can see the occipital. So the occipital is in the back of the head. We always say like you have eyes in the back of your head is a good way to remember it. It's the back of the skull. So if we keep looking at the synaptharsis joint here, we actually are able to see the parietal bone. So we have 2 parietal bones left side and right side of the parietal bone. You'll see it sort of makes up the top of the head here. As we turn, we see our frontal bone. Frontal bone is here at the front, all the way down to the eye socket. If you see here, you can see the synaptharsis joint that allows for the frontal bone. And then on either side, we have the temporal bones. Temporal bone here, temporal bone here. Finally, we have the sphenoid bone, which is a little bit hard to see. I don't actually think I even see it on the skeleton, but it's inside. If we were to cut this cranial open up on a transverse plane, we'd see a large butterfly-shaped bone that makes up the bottom of the cranial cavity. So just to go back, we have 8 osseous parts form the cell. The ethmoid bone, E for 8 and E for ethmoid. Occipital bone is in the back. Our occipital bone is right here. Parietal bones are here on the sides. We have 2 parietal bones, left and right. They sort of make up the top of the cranium. Frontal bone, F. Frontal bone here. You can see here, about till here is the frontal bone, and then temporal bone is on the left and the right side, so you'll see here. And then finally the sphenoid bone, which is difficult to see, but it's a butterfly-shaped bone on the inside of the cranium. A lot of the facial bones are unfortunately not visible on the skeleton because they're just too small in particular. But we know the facial bone mnemonics is my mouth's palate never liked zucchini and vinegar. Mouth, so for my is the mandible, so you can see the mandible here. This is the mandible. We said in class the manly mandible, that manly jawline here. Mandible goes all the way across on both sides. That's the jaw. The mouth is the maxilla. Maxilla is this bone here, sort of makes up the maximum area of your face is a good way to remember it. The palatine bone is the palate. It's a little bit hard to see, but I don't know. Yeah, as I was saying, it's a little bit hard to see, but you can actually see there's 2 palatine bones, a left and a right. And if you look, you can see the joint separation there, and that's above the palate. Then we have the nasal bones, the lacriminal bones, which are in here for our tear ducts. Someone said a lacriminal, like a criminal cries. It's a good way to remember. Zucchini is zygomatic. That's your cheeks. The inferior nasal conchae is sort of in here. And then your vomer is also in your nose. So a few of them you can't see, but it's a good understanding all in all. So again, it's my mouth's palate never liked zucchinis and vinegar. Mandible, maxilla, palatine, nasal, lacrimal, zygomatic, nasal conchae, and vomer, excuse me. Okay, so we looked at sort of the types of bones, and then we looked at the cranium, and now let's take a look at the vertebral column, excuse me. So right now we're still in the axial skeleton, right? We're still in that sort of main trunk of the body. We have not yet moved on to the appendicular skeleton. So if we talk about the vertebral column, excuse me, this is used to protect the spine. That's the main function of the vertebrae. And when we were children, we had 33 vertebrae, but then as we got older, these vertebrae down the bottom actually started to fuse. So now we have 26 bones of the vertebral column. So we divide the vertebral column up into 4 different sections: the cervical column, the thoracic column, the lumbar column, and then the sacral area. So if we talk about the cervical area first, the cervical area kind of goes from the cranium to the thoracic bones. So there are 7 cervical bones. 1, 2, 3, 4, 5, 6, 7. And then if we move down, we continue on to the thoracic area. There's 12 bones in the thoracic area. They're easy to see on Ralph because they're in red. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And then if we move down here to the lumbar area, there are 5 lumbar area vertebrae. So we're back to the non-red. 1, 2, 3, 4, 5. And then we're going to come down here to the sacral area and the coccyx. So if we're looking at the bones superiorly to inferiorly, how are we going to remember there's 7 cervical, 12 thoracic, 5 lumbar, and then our sacral bones? We can remember that. So from top to bottom, we breakfast at 7 a.m., we eat lunch at 12 p.m., and we eat supper at 5 p.m. So 7, 12, 5, 7 a.m., 12 p.m., 5 p.m., breakfast, lunch, supper. If we want to continue that a little bit further, we can think to ourselves, we're eating a crunchy breakfast at 7 a.m. C for crunchy, cervical. 1, 2, 3, 4, 5, 6, 7, cervical, crunchy. And then a tasty lunch at 12, T for tasty, T for thoracic. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And then we eat a light supper at 5. L for light, L for lumbar, 1, 2, 3, 4, 5. When we're talking about the vertebral column, I want to talk about the sacral region, the coccyx as well. So this lower area here is made up of 2 bones. This is called your sacrum, and this is called your coccyx. If you look at this coccyx here, you'll see that it's a very bony, prominent bone. It sticks out quite a bit. And as in nursing, we'll often sometimes see if patients are bedridden or don't have the mobility they used to have. They might be quite frail and have small amounts of adipose tissue for protection, and then through friction and shear and transferring patients, they can often develop decubitus ulcers or bed sores in these areas here. So in this sacral region here, you see the bony prominences. That's a common place that we may see skin breakdown and possibility of ulcers. And then also down here a little bit further in this coccyx area, see this is this pointy bone here. This can often lead to issues as well. This coccyx area is often found sort of right in between the gluteal folds of a patient. So when you're looking after patients, be really mindful of all of these bony prominences as we continue on. Depending on how thin they are, we might have issues with the vertebral column. If it's quite superior to their skin, we could have issues with their elbows, but especially the real danger areas of the sacrum area and the coccyx. So while we're back here, let's take a look at the position of the spine. So it's on a straight horizontal line down. It concaves and convexes. Up here at the cervical region here, this is a concave region. It caves into the body, it faces inward. As we move on to the thoracic region, it convexes out, it moves out, and then we get back into the lumbar region, it caves back in again. And then as we move down towards the sacral region, it convexes out again. So it creates this almost fluid direction, and that helps with movement and helps the flexibility of our body. So again, cervical concaves in, thoracic out, lumbar in, sacral out, concaves and convexes. Moving on from the vertebrae to the thorax. So the thorax area is the area that protects the heart and the lungs. And if we see here, we're talking about the ribs. There are 12 pairs of ribs in total. So 24 ribs altogether. This here is the clavicle we'll talk about in a minute. The first thing that we have are 7 pairs of true ribs. So if we count 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7 here. You will see all of these connect to the sternum. This here is the sternum. It's the large protective bone in our body. So it's connected through cartilage. These 7 true ribs are connected to the sternum. Once we get past there, we're going to get into false ribs. We have 5 pairs of false ribs, or 10 ribs in total. 3 of those pairs, 8, 9, and 10, 8, 9, 10, 1, 2, 3. These are attached to the 7th rib's cartilage, but they're not attached to the sternum. So they're not officially considered, these 3 here, true ribs. Can you see what I'm pointing at? Yeah, so they're not considered true ribs because they're not attached to the sternum. They are considered false ribs because they attach to this number 7 cartilage instead of to the sternum. Additionally, underneath you'll see these 2 pairs of floating ribs. If I look at these 2 pairs here, you'll see they are just what they call floatings. They're attached to the vertebrae in the back, but they have no attachment to the sternum in the front. So if I count them again, we have 7 pairs of true ribs. So we have to remember there's 2 of each. So there's 1 connects on one side of the vertebrae and 1 connects on the other side of the vertebrae. So we have 1, 2, 3, 4, 5, 6, 7 pairs of true ribs. They connect all to the sternum. After that, we have 1, 2, 3 pairs of false ribs that connect to this 7th rib cartilage, but don't connect to the sternum themselves. And then these last 2 at the bottom are floating ribs. I don't know if you can see the color difference. Yeah, that looks great if I turn it to the side. So we can see this sort of off-white color, this like beigey color is the cartilage, where this is sort of more of the bony color. So again, 1, 2, 3, 4, 5, 6, 7. So you'll see here, this cartilage, so the bones don't directly connect to the sternum. There's this cartilage in the middle, but as we get down to here, these don't connect to the sternum at all. They just connect to the cartilage themselves that connect them to the sternum. And then the floating ribs, you can see them right here and right there, and see how they're not attached to this rib cage. Believe it or not, that's pretty much it for the axial skeleton. So we're going to move on here to the appendicular skeleton. So the appendicular skeleton, we're talking about appendages, right? So for right now, let's talk about the upper extremities. First thing that we have are 2 humeruses. These are the upper arms here. So the left and right side here, these are your humeruses. We've talked about these already. These are considered long bones. This is a good angle right here. And then moving more down the arm, we have the radial bone and the ulnar bone. We know from our nursing skills that to find a radial pulse, you go by your thumb and you check your pulse right directly underneath your thumb. And to find your ulnar pulse, you go underneath your pinky finger to be able to check your ulnar pulse. So that makes it pretty easy to figure out which one's the radius bone and which one's the ulnar bone. Ralph here. So here I have, this is my thumb here. So this one right here is our radial bone. This one here is our ulnar bone, okay? And then we can move on right into the metacarpals, which is our wrist. We have 8 of these small bones that we have talked about before. So 8 on each side gives us 16. We have 5 bones here that are called the metacarpals. 1, 2, 3, 4, 5. These bones are in the palm of my hand, so I can't really see bones here, but that's right here, right? That's a good idea. If I place my hand like this, we can see the 8 bones of the wrist here, the 5 bones of the metacarpals. And then we have our fingers. And our fingers actually have 14 bones in each hand, which make up 28 in total on both sides. There are 3 bones in each finger and 2 in the thumb. And if you look at your hand, that actually makes sense. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 bones in my phalanges. So that's our appendicular skeleton upper extremities done. Let's take a look at the lower extremities. I want to talk about the hip bones for a little while. We actually only have 2 hip bones, 2 coxal bones here, but they're quite large, so we actually break them up into smaller little parts. This side here in the anterior view is called the ilium. If we move around to the back, that same area on the back, or the posterior I should say, is called the ischium. Move to the front, the anterior again. This area down below is the pubis area. And then in the back, which we've already discussed, is the sacrum, and that small bone there, which is the coccyx. We utilize the hip bone, this ilia here, this crest is called the iliac crest. We're gonna talk about that in a couple minutes, but this is a really big helper for landmarking when we do intramuscular injections. Lower extremities, as we make our way down, we have our femur. Femur here, go with that well. The femur is the largest and strongest bone in the body, one on the left, one on the right. We move Ralph up, you can see here, we have the patella, which is the knee. Down here in sort of the shin area, we have the tibia and the fibula. Tibia is the larger bone and the fibula is the smaller bone. So we make our way down to the foot. We'll see here we have 7 small bones here in the tarsal area. That's sort of like in the ankle region, the bend of the foot. And then 10 in the metatarsal. So same as before, so think of like the sole of your foot or the palm of your hand is the metatarsal. So 1, 2, 3, 4, 5, because you have 5 toes. And then we have 28 phalanges, 14 on each side, so 14 bones in each toe. There's 3 bones in the small toes and then 2 bones in the great toe. So if we look, it's sort of hard to see. 1, 2, 3 bones in the pinky toe, and only 2 bones in the toe. So if we're talking comparing the hands and the feet, it's really similar with a couple just minor changes. So if we're talking about the hands, we're talking about the wrist bone is the carpal bone. There's 8 bones on each side, 16 in total. How to remember that? Carpal tunnel, carpal bones, right? That's the wrist. And then the metacarpals, carpals. So hands are always with the C. Metacarpals, there's 5 metacarpals. And then you have the phalanges off of that. So carpals, metacarpals, and then phalanges. I always think of how to remember which one's the metacarpal and which one's the carpal. M's in the middle, it's in the middle of the hand. And then if we move on to the feet, instead of carpals and metacarpals, it's tarsals and metatarsals. All right, let's get this guy up here. So again, we have 7 tarsals here at the bend of the foot. In trouble here, 7 small bones, and then we have the 5 metatarsals here that connect to the phalanges. So remember, tarsals like toes for tarsals, and then carpal like carpal tunnel. So the last thing I want to talk about is just how we use the skeleton to landmark. Ralph's been a very helpful yet quiet helper here. But we can use the skeleton, the skeletal system, and our bones to really help landmarks know what we're doing as nurses. So landmarks are divided into 2 categories, processes and depressions. A great example is if you look at the hip. If we look at the hip here, you can see this pelvic bone has a really obvious depression here, an indentation that allows the femur and the head of this trochanter area here to fit just right in here smoothly. So that helps with our movement and mobilization of a joint. When we're using, learning about giving IM injections or needles or landmarking for physical assessment, we're going to be able to use the skeletal system. For example, this here is called the acromion process. This is the little projection or prominence on the humerus here to complete an IM injection. We feel for the acromion process and then do a few fingers down, and then our IM injection will be somewhere around here. For example, for an IM injection, we utilize this greater trochanter, which is this here prominence right here. Put that on the palm of our wrist. Try and line up our fingers around the iliac crest, and then our injection should be somewhere in the middle here. this is all information that you're going to learn as we go to skills 2, which is really important to know that the skeletal landmarks really help, especially their processes and depressions. I think that's really pretty much it for Ralph. Hopefully you stuck along. If you have any questions, I'm going to keep this guy in my office for a couple more days. It's hard, I know. Actually, I'll bring him to the lab. I'm going to bring him to the lab on Tuesday. Unfortunately, if you're an IB student or a Turo student, don't drive the 4 or 5 hours to come down just to meet Ralph. But and then if you have any questions after class or something, we can definitely take a look closer. If you need me at all, just feel free to send me an email. Thanks a lot.